Hey there, welcome to Honesty's channel. Today I want to talk about a serious topic, and that is pre and postpartum depression in pregnancy. Now, there are different types of depression in pregnancy, such as the baby blues, prenatal depression, which is the prepartum, or postpartum psychosis. Depression during and after pregnancy occur more often than most people realize, and a lot of women are too scared or nervous to even talk about it with their friends, family, or even their doctors. For many different reasons. They might just be shy, or they don't want to broach the subject to a doctor or family members because it might make them feel like they're not being a good mom, or they're scared that if they have these feelings of depression, it's not normal because shouldn't you be happy that the baby's coming? And they might even be happy that the baby's coming, but they still are so overwhelmed with everything that's going on, all of their hormonal and body changes, or day-to-day struggles that people go through with finances and arguments, or just overwhelming situations that cause these depressions. Approximately 15% of women experience significant depression following the childbirth, and these numbers are even higher when dealing with financial struggles, or twice as high for younger parents, such as teen parents. About 10% of women experience depression in pregnancy. In fact, prepartum or prenatal depression is the most common complication of childbirth. And a lot of people are unaware of these statistics, so they just don't talk about it. But it is something that if you don't feel comfortable talking to a friend, family, or medical practitioner, find someone. Even if you don't know them in person, find someone online that you can talk to, um, or any women communities or birthing classes and communities where you can talk to other moms or other people who are pregnant. Some of the symptoms can start anytime during the pregnancy or the first year postpartum, and they differ for everyone and might include the following: of feelings of anger or irritability, lack of interest in the baby, appetite and sleep disturbance, crying, sadness, feelings of guilt or shame, even hopelessness, loss of interest in anything, joy, pleasure in things that you used to enjoy, possible thoughts of even harming the baby or yourself are severe symptoms that not everyone has. Some of the risks: it's important to know that there are risk factors for the pre and postpartum depression. So make sure that you research, even if you're going to research yourself and not have a medical practitioner give you the information. Research your family history of depression, anxiety, or postpartum depression. If you have any disorders or family members had any disorders. If you feel inadequate in support for carrying the baby. If you have financial stress, marital stress, complications in a relationship or in the pregnancy, birth, or breastfeeding. A major recent life change, such as a loss, you're moving, you lose your job, you're changing careers, anything like that. If you have other children, you're a mother of multiple children, that could be pretty overwhelming. Mothers whose infants have been in intensive care, mothers who've gone through infertility treatments and have kept trying and trying and trying to have a baby. If you have a thyroid imbalance, or if you have any form of diabetes, including gestational. Now, postpartum and antepartum depression are temporary, and they're treatable if you can get professional help, or if not, just try to reach out to someone, even if you don't know them in person. You'll be able to talk, and sometimes just talking to someone will make you feel better, and you'll know that you're not the only one, because it's true. You're not the only one who gets sad or depressed sometimes. Even though it's a really happy time, in your life. You're excited to have a baby, and your body is just going through all these different changes, and your hormones are going crazy. So it's all right. And, you're not alone, and there's no reason that you need to feel alone. So, the different types of depression during and after pregnancy: the baby blues. Many women have the baby blues in the days after childbirth. In fact, there's an estimated that 50 to 80% of all mothers experience this postpartum blues after birth. For most women, baby blues is temporary, and it usually is gone within a few days or up to lasting 2 weeks after childbirth. If you're having the baby blues, you may have mood swings, feel sad or anxious, or just overwhelmed, having crying spells, lose your appetite, or have trouble sleeping. The symptoms aren't usually severe, and there are effective ways to handle them. Try to get plenty of sleep, even if it's hard for you to get any sleep. Try to take naps when your baby does. Take the pressure off yourself. You can't do everything by yourself. Nobody can. You need to have some support system. If you're a single mother, reach out to your friends or family. Or if you do have a mate, then have your partner help you with the baby or help take care of other things such as cooking or cleaning or just running errands, doing anything that needs to be done so you don't have to feel like the weight of the world on your shoulders alone. Avoid spending too much time alone. Try to reach out to people and don't isolate yourself. Don't keep yourself in solitude. Be able to talk to friends, family, or anyone on social media. There are plenty of mom communities out here on Facebook, Twitter, YouTube, or in birthing classes. Get help and support from your spouse, family members, friends, anyone that you know. You can also join a support group for new mothers. Getting plenty of exercise can be a healthy and good way to knock the depression. Now, there's prenatal depression, which is like prepartum depression. It's also a term for postpartum depression as well. The symptoms of the prenatal depression last longer than the baby blues, and they're more severe. It occurs in about 1 to 5 women, which isn't that large of a spectrum when you think about it. Pregnant and new mothers who find themselves overwhelmed, frustrated, or anxious, depressed should not be silent or ashamed. They should be able to feel like they can talk to someone, even though I know it can be difficult for most women. Symptoms of this form of depression can be sleeping too much or not at all. It's a large spectrum. The lack of joy in life, emotional numbness, trouble concentrating or remembering things, hard to make decisions, loss of interest in caring for yourself, just letting yourself go, staying in bed all day, not even wanting to get up or shower or get dressed, put on your makeup, do anything. You might withdraw from friends and family and isolate yourself, have loss of sexual interest or responsiveness, a strong sense of failure or inadequacy, along with severe mood swings, showing too much or not enough concern for the baby. There's that large spectrum again, where it's either this or that, but it's like high and low. High expectations and overly demanding attitude, and difficulty making sense of things. There are treatments to these forms of depression. And a lot of it is just like talking to people, having a strong community that will be able to help you. Uh, there are medications, but I would not recommend, personally, would not recommend taking any form of depression pills or medications like that. I just don't agree with that form. But there's therapy, or you can just reach out to friends and family, is, I think, the best way to do it. Even when my doctor, like, sometimes suggests that I take medications for, like, nausea or depression during pregnancy, I'm like, You know me, doctor. I don't like to take pills. I'm cool off that and I'll work through it. You know I'll get through it. And he's like, yeah, I know you. So, but everyone's different and everyone is allowed to have their own preferences. And if you feel like you do need the medication, then you should talk to a medical practitioner or your physician. If things are not getting any better for you, don't hesitate to reach out to your doctors and your child's pediatrician. With postpartum psychosis, a very small number of women, that's one or two in about 1,000 women, suffer a rare and severe form of depression called postpartum psychosis. Now, that's the third depression during pregnancy that we're going to talk about today. Women who have been diagnosed with this bipolar disorder or a condition called schizoaffective disorder are at a higher risk for getting postpartum psychosis. The symptoms of the postpartum psychosis typically begin during the first 4 weeks and after delivery. They may include extreme confusion, hopelessness. They cannot sleep even when they're exhausted. They refuse to eat. They distrust other people, seeing things or hearing voices that may not be there, or thoughts of hurting yourself, your baby, and or others. Postpartum psychosis is temporary, and it is treatable with professional help, but it is an emergency and requires immediate help. Please don't just be silent. Get the help that you need. And partners also get depressed too. Not just new mothers, but new fathers are also at an increased risk for developing depression. In general, men are more likely to avoid expressing their feelings and discussing their emotions than women. They deny that there's a risk and do not seek the help that they need when they need it. However, fathers with depression struggle to support their partners and their children, and this increases a mother's risk of depression. Depression in fathers is believed to be just as treatable, but is often not recognized. So be aware that both mommies and daddies need to be able to talk and feel like someone will listen to them and not be too scared or anxious to be able to broach the subject of being depressed, even if it's during a really happy time in their lives and they don't understand their depression themselves. There is not much research on depression in same-sex or non-biological parents, but clinical experience suggests that starting a new family can be a difficult transition for all parents, regardless of the kind of relationship that they have. Therefore, any parent who has difficulty coping with stress or parenting or experiencing any symptoms of depression should talk with a doctor or a child's pediatrician. Talk to your healthcare professional. Screening for depression once during your pregnancy and at 1, 2, 4, and 6 months after pregnancy should be a routine part of you and your baby's healthcare. Healthcare professionals such as your doctor, your baby's doctor, a nurse, and other healthcare providers are familiar with the types of depression and a new and expectant mother's and father's face. They know ways that they can help, and they're ready to listen to you whenever you're ready to talk, and they can help put you on the road to recovery. So please remember, any women or men may become depressed during pregnancy, during and or after the baby is born. It doesn't mean that you're a bad parent. It doesn't mean that you're not put together. In fact, getting treatment and the support that you need means that you are an excellent parent and that you are concerned for you and your baby's health. It makes you the bigger and better person to talk about it, so you and your baby don't have to suffer. There is help available. All children deserve the chance to have a healthy mom, a healthy dad, and healthy living environment. All parents deserve the chance to enjoy their life and the lives of their children. So welcome to parenthood, even though it's going to be a crazy ride and very emotional and you're going through all these different changes, it's all right to sometimes feel overwhelmed or anxious, stressed, depressed, and don't be afraid to talk about it. So this is Honesty signing off with Honesty's channel. Thanks for watching, and please write any comments or suggestions down in the comment section below, and I will try to get back to you as soon as possible. Have a great day.